what Galarrwuy Yunupingu has called a final settlement.
A former Director General of WA's Health Department says the state's Medicare funding needs to rise dramatically if the health budget is to be repaired. Kim Snowball says a shortage of GPs compared to other states is costing the WA community hundreds of millions of dollars each year because people are being treated in hospitals instead of clinics.
These first-year medical students at Curtin University are learning the basic skills of general practice.
You should feel the pulse first.
And some of them plan to make a career out of it.
For the moment, I'm really keen on just becoming a GP.
You get to get really close with the patients and have long-term relationships with them. You get to know them over a long period of time and really get involved, which is quite fascinating for me.
If they complete their training, the students will help address a long-standing trend. WA has fewer GPs per person than the national average, which Kim Snowball believes is at the heart of the cost problem in health.
My pitch is to say, don't just focus on hospitals. The key issue is actually in primary health care, and we need to get both of those right.
The former Director General says WA's community health sector misses out on $430 million in Medicare funding each year because of the GP shortage, meaning more people are treated in hospital, which is more expensive and shifts part of the cost burden to the state instead of the federal government.
That's a big hole for the state and it's an issue that needs to be dealt with pretty quickly.
In rural health, experts say the doctor shortage and Medicare shortfall is acute.
Of that 430, around 100 million we estimate is underdone or unspent in the bush.
In WA, there are 9 towns with at least 100 people that either have no GP or are more than 50 kilometres away from one, and a further 27 towns with up to 1,000 people served by a single GP, a situation that could be addressed by technology and the federal government.
We think of GP video service, recognised by the Medicare Benefits Scheme, will be important for occasions where a solo GP leaves a community and there is a delay in attracting a replacement.
The Health Minister Roger Cook says WA is being shortchanged by federal funding and tabled a paper on the issue at COAG.
Western Australia should be considered for a special arrangement or agreement with the Commonwealth, and we've indicated that we're very keen to sit down with the Commonwealth and make that happen.
But the Federal Minister has indicated WA won't get a one-off grant from Medicare to cover the gap, because funding is tied to service delivery.
Medicare funding responds to particular services. What we can do is exactly what we are doing, is providing immediate, current, rural GP training programs.
Mr Hunt says the government will soon appoint a Rural Health Commissioner and telehealth will be a key priority. Emily Peace, ABC News.
In